There's a silent killer on the loose. Every day, 15 people die from cardiovascular disease in Singapore. Globally, an estimated 16.9 million people died from cardiovascular disease in 2000. By 2030, almost 23.6 million people will die from the disease every year, with the largest increase in number of deaths occurring in the Southeast Asia region. At the heart of the matter, crucial advances in the understanding and treatment of cardiovascular disease remain to be made. The National University Heart Centre Singapore, or NUHCS, is a leading centre in Singapore and the Asia-Pacific region. Tapping firmly into the pulse of the future, the aim of the NUHCS is to provide world-class, specialised and dedicated cardiovascular healthcare service to patients, addressing the healthcare needs of Singapore and beyond.
We want to be a place where patients can seek the best treatment possible in the form of a high-quality, coordinated and personalized care, be it a local patient or a foreign patient. We have organized our clinical programs into 6 core programs because of their strategic importance, really to meet the need of the Singapore population. They include heart failure, acute coronary syndrome, vascular medicine, structural and congenital heart disease, heart rhythm disorder, and women's heart health.
At the NUHCS, the heart failure program prides itself as being one that is multidisciplinary, holistic, and always patient-focused.
It is a multidisciplinary team aimed to look after a patient in a very holistic fashion, ranging from not just medical problems, but also his daily activities. For example, we have a team of cardiologists, nutritionists, physiotherapists, occupational therapists. We hope to allow the patients to recover quickly from their conditions and be able to return to their home and family.
When dealing with acute coronary syndrome, commonly known as a heart attack, time is of the absolute essence. And at the NUHCS, the feat of compressing time has been refined to an exact science.
Door-to-balloon time represents a time when the patient presents to the ER door and having the balloon delivered to open up the artery. The international benchmark for door-to-balloon time is 90 minutes. Our door-to-balloon time is now 57 minutes, and that nearly 80% of patients would have the procedure done in less than 90 minutes. So this is really an outstanding result, and we are quite proud of it.
In our aging population, vascular disease is a common cause of disability and mortality. Lack of awareness often leads to patients seeking late treatment. This results in a higher incidence of lower limb amputation, which the NUHCS is dedicated to lowering.
It is estimated that in Singapore per year, there are 700 amputations performed. So limb preservation is a worthwhile endeavor. There's a whole armamentarium of technologies to improve blood flow to the lower limb. But it doesn't end there. There's also a lot of nursing care, wound care, rehabilitation, risk factor modification. The thrust is limb preservation, but the primary thrust is always to improve the quality of life of our patients.
Patients in the structural and congenital heart disease program benefit from a continuum of care that spans all ages, utilizing the very latest in clinical care.
TAVI stands for transcatheter aortic valve implantation, and it is actually a very new program. Patients with severe aortic stenosis, if left untreated, are going to die 50% of the time within 2 years of follow-up. Now, with TAVI, we can actually reduce mortality by an absolute 20%. So this is a highly effective and truly a life-saving operation.
Heart rhythm disorder, or arrhythmia, is commonly seen in the general public as well as in heart patients. As a subspecialty field of cardiology, cardiac electrophysiology encompasses the detailed evaluation of arrhythmias, including their mechanism and treatment.
Our heart rhythm program has got a slogan which says, put your rhythm right. And in so doing, it actually provides a comprehensive health service in the form of high-end diagnostic and therapeutic capabilities. In fact, National University Heart Center is a training center for regional cardiologists who want to specialize in heart rhythm.
Cardiovascular disease is the leading cause of death among women in Singapore. But many are still unaware of the dangers posed by this silent killer. At NUHCS, Women's Heart Health is the first program of its kind in Singapore, dedicated to improving the health and quality of life of women living with or at risk of heart disease.
And we aim to provide a multidisciplinary, seamless service consisting of a cardiologist, a dietitian where the woman can learn how to eat and to cook properly for the family, a physiotherapist where she can get an exercise prescription and learn to take care of her body, a occupational therapist, and a life coach who can help her with stress management. And then we have a very close link with the disciplines that are intimately linked with the health of a woman's heart.
Research is the foundation upon which clinical care is further advanced. Aimed at translating the research efforts of the NUHCS, the Cardiovascular Research Institute, or CVRI, was formed, with one of its cornerstones in the vital area of biomarkers.
Biomarkers can be extremely useful in diagnosing a condition, telling you how severe it is, telling you how you might treat it, and then telling you how well you're treating it. Singapore is very strategically placed for research, and I think one good example would be our heart failure study. The project that we've engaged in involves 6 centres in Singapore and 4 in New Zealand, and our findings will be applicable internationally and hopefully will lead on to an improved management of that kind of heart failure.
With wide-ranging benefits, biobanking, which is a crucial database of ethically obtained patient information, will also aid the CVRI in advancing cardiovascular treatment.
This is really to look at the Asian phenotype to see whether Asian patients or the patients we treat are different from the rest of the world. This is a very important question we have to answer because Singapore is a melting pot of different cultures and we are the ideal place to study this.
So it's like having a treasure trove of precious resource in Asian patients right at your doorstep. In fact, I can't think of any other biobank that's available in Asia.
The highly experienced physicians and surgeons at the NUHCS also train and nurture the next generation of healthcare providers, passing on their knowledge and skills.
National University Heart Center has a mission in training our undergraduates to provide them with this solid ground in clinical medicine. The Heart Center also has advanced specialist training to train cardiologists and cardiothoracic surgeons. We also have a very comprehensive nursing training program directed at nurses who want to be involved with cardiovascular care.
Besides training medical personnel, both local and overseas, the NUHCS is also committed to educating the public on medical problems of the heart. A variety of community outreach programs have been initiated by the NUHCS, patient support groups being one of them.
We feel that if we can gather patients with similar conditions, they can help to motivate, counsel, and support each other. We regularly conduct health screening and teaching programs to the public, educating them on the latest in cardiovascular care. We are also very active in working with Singapore Heart Foundation and various voluntary heart organizations in Singapore to try to promote general cardiovascular health.
The NUHCS, a center that will continue to set the benchmark for cardiovascular healthcare in Singapore and beyond.
It's in our name. We are the National University Heart Center. And where else are you going to find an academic center that is right at the doorstep of the university, where we have direct links to scientists at the cutting edge of research And we have direct links to medical doctors seeing patients in the National University Hospital.
We've brought together a program which is multidisciplinary and caters in a holistic manner where the patient is in the center. The doctors come around the patient and see to their needs.
National University Heart Center wants to be a world-class tertiary cardiovascular care center. We want to make National University Heart Center a place which Singapore can be proud of.